Hey, it's Dr. V, your favorite Psych NP. Welcome back to my channel where I'm inspiring other nurse practitioners to hopefully start their own practice and stop working for someone else. All right, so today I'm going to lay out the steps that I took in Arizona to start my own private practice. Arizona is a unique state where I can practice independently as a nurse practitioner. That may not be the case depending on what state you're in. All right, so step number one, and probably the most important step, is finding a name. And I know that sounds silly, but you need to find a name that encompasses what you do, who you are, your message, and someone already doesn't have it. I say that because 90% of your patients are going to be looking at Google to find psychiatric care. And then the second thing they're going to look at is your reviews. And they need to see a name that encompasses all that you provide, what you do, who you are. And it's very difficult. The name of my practice now is called Mental Health Now. And I pride myself on having weekly availability for my patients. All right, step number two is you're going to need to find yourself an accountant. You're going to need to find someone that is going to help you distinguish between a LLC, a PLLC, a S corp, etc. You need to know what financial situation you're in, how much money you're going to have for your initial costs, how much you're going to expect to be intaking and how soon, how are you going to run your taxes, are you going to do a nonprofit organization, what are you going to do? So you really need the help of professionals, accountant, or a lawyer. All right, the third thing and most important thing before you proceed anywhere is providing yourself with malpractice insurance. So, malpractice insurance, the core things that you need to know is the difference between tail end and non tail end. Okay, after that, you're going to have to distinguish if you're going to be seeing patients in person or online or both. That's a whole other thing that you're going to have to consider because you're going to need to have insurance and business insurance. All right, so after you got your name, your accountant, your building, your malpractice insurance, and you know what kind of clients you want to see, you're going to need an EHR to see all these patients. Electronic health record, whenever we send medications, we're going to need to send them via a secure two-way authenticator, whatever your state uses, but we don't use paper prescriptions anymore, especially for controlled substances. Your EHR needs to be a one-stop shop where you can do billing, you can see appointments, you can have a telehealth HIPAA secure platform, you can order labs, you can receive messages, you can have an interface with the patient. All the things need to be able to be done from one system. Okay, once you've set that up, the next step is marketing. You're going to need to see how you're going to market. The most cost effective way is to look around locally and see what other practices are there. Go introduce yourself, let them know that you exist, what services you have, and see if you can benefit each other mutually. For me specifically, in my area, there's a small percentage of Spanish speaking clinicians and therapists. So, I go and introduce myself and let them know, hey, I speak Spanish in case you have any clients that need Spanish speaking services. So it's going to be dependent on your community, how well you're established, but you need to basically network. That's the free way. The next way would be to hire a marketing company where they're going to charge anywhere between $5 to $1,000 a month. This might also be a service where they can develop your website, they could send out monthly newsletters, they can manage your social media account. There's a lot of options with marketing. Basically, sky's the limit. As long as you got the money, they can do it for you. Setting up billboards, setting local flyers with what insurances you have, all these things are going to be part of your marketing program. A good marketing program is going to be anywhere between 1,000 to 5,000 a month, depending on your city. Initially, some tips that I would recommend when you're first starting out is to check out companies like Headway, Alma, Rula, where you're going to be either paying a monthly service for them to do all your billing, your credentialing with insurance, or you're going to be giving a percentage of your appointments to that company. The easiest one to start with is Headway because they don't have any upfront costs. They get you credentialed. They also have a platform that you can use as an EHR, so they make it pretty easy for you to start. The only downside is their billing rates are a little bit less compared to other companies like Alma and Rula. Another tip I can give you is checking out the Elite NP. That's the program that helped me start my practice. The Elite NP is a nurse practitioner who has three different clinics. I don't know how many he has now, but very grateful for his program. He has very specific programs depending on what kind of specialty you want to get as an NP or even a RN. Lastly, if you are looking for more detailed information or specific one-on-one, or you want to pick my brain and talk to me, you can check the link in my bio or check my website, mhnarizona.com, where you can book an appointment with me and we can talk about your goals and dreams related to Psych NP or as a nurse practitioner. I started as a CNA in 2010, and now in 2025, I'm a doctorate of nursing practice with the focus in adult psychiatry and a board certified psychiatric nurse practitioner with their own private practice. Furthermore, I specialize in ketamine assisted psychotherapy. Check out my website if you want more information. Leave any questions, comments, or concerns down below, and I'll see you on the next one.